Good afternoon. Good afternoon. Hello, Rhode Island. I hope everybody had a nice weekend. It was finally a summer weekend, so hopefully everybody had a chance to go outside and enjoy the weather. We are going to continue this week with press conferences Monday, Wednesday, and Friday, each day at 1 o'clock. So today, Wednesday, and Friday, press conference at 1 o'clock related to the COVID crisis and our response. I would encourage you to tune in. Information now is arguably more important than ever. Things are changing, and so we want to make sure that you're informed and you have all the information you need in order to keep you and your families safe. I would say that Rhode Island is in a good place. People are asking me regularly if we're in a good place. Yes, Rhode Island is in a good place. We'll share the data in a second, but we're in a good place because of the people of Rhode Island. People have pitched in and done what they have been asked to do: wearing masks, washing hands, staying home when you're sick, shutting down your businesses as required, reopening your businesses in a very limited way, putting on hold going to church or synagogue, your wedding, your family parties. None of it has been easy. In fact, it's all been incredibly difficult. But if you look around the country, our experience is very, very strong. And we are where we are today because of your hard work and your willingness to follow the rules, and your willingness to help a neighbor, and your willingness to look in on an elderly person so they wouldn't have to leave the house to go to the grocery store. All of this sounds so simple, but it is these simple things that are saving lives. It's these simple things that are allowing people to get back to work. And it's these simple things that have allowed Rhode Island to distinguish itself as a state doing among the best in the nation related to the COVID crisis. So as we begin another week together, I have to begin with a thank you, because every one of you is working hard, and it is working. And I will say, as we go forward, I'm really looking forward to entering phase 3, relaxing the rules even more. Our ability to do that depends on you following the rules. Today marks the second week of entering phase 2. So exactly 2 weeks ago today, we started phase 2. So now we need another couple of weeks to observe the data from the changes we've made in phase 2. And then hopefully we'll be able to move on to phase 3. Here's the deal. The virus is alive and well. It's out there. People are getting sick every day. Look at other states. Look at Arizona. Look at other states. They're starting to see a surge in cases. They're starting to see a surge in hospitalizations. The virus hasn't gone anywhere. What's changed is us. We've changed. So I'm going to ask you, please, we don't want to be like one of these states where we start to see a spike. And we don't have to be that if everyone keeps following the rules to the best of our ability. And I'm just going to remind you that our ability to keep opening the economy depends on everybody's willingness to follow the rules. But as I stand here today on this Monday morning, 2 weeks into phase 2, I feel confident that we are in a good place, and we've worked together very well under very trying circumstances to position Rhode Island where it is today. So now I'd ask you to please put up the data slide. As you can see from the data on your screen, we continue to move in the right direction. We have 32 new cases, and very sadly, another 6 deaths. 32 cases is great news. Lowest number we've ever had, and we continue to test thousands of people a day. Hospitalizations are going down. I will say another 6 deaths, as many times as I've had to get up here, it's never easy to say an additional number of deaths. So please just remember that this is a very difficult virus, and every day we continue to lose loved ones, and I would ask you to keep them in your thoughts, in your hearts, and in your prayers. I want to start today by talking a little bit about the weekend, and I'm going to do that every Monday. Weekend is a time people are out, more social, go out for dinner, go to the beach, go to the parks. We have, we increase our inspections over the weekends, and I'd like to share with you a little bit about what we saw over the weekend. Not surprisingly, a lot of people were out enjoying our parks and beaches. That's a good thing. That's why we reopened them. The beaches almost reached capacity on Saturday, but we did not have to close any of the beaches. And overall, people did an excellent job of social distancing, staying 6 feet apart. Most beachgoers did opt for online food ordering from the snack bars at the pavilions. And I would encourage you to do that. If you're on the beach and you want to order food or drink, order it on your phone. They'll send you a text when your food is ready. Grab your mask, go up to the pavilion and get your food. That way there, we don't want you waiting in line. We don't want any crowds at the pavilion. So remember, if you go to the pavilion, take your mask with you. Please don't wait in line. If you have to wait in line, 6 feet apart. But it's worked very well this weekend. It's a new feature, it's different. Usually we just go up and get our food, but text ahead of time and they'll text you when it's ready. And thank you so much to DEM. You did a beautiful job this weekend, and thank you to all the concession owners who were cooperative. We did have to close Lincoln Woods and Colt State Park briefly over the weekend. Lincoln Woods and Colt State Park are some of our most popular parks for good reason. They're beautiful. And I want to thank those of you who were turned away. Sorry that we had to do that. I will say people were fantastic. Again, I'm proud to be a Rhode Islander. People were patient. People were understanding. They waited their turn. They came back later when we were allowed to allow you back in. So I want to thank you. Park rangers did see some large groups in the parks, and they were able to disperse without incident. But once people were made aware that they were in a crowded group, they all dispersed. Our goal through this whole thing is voluntary compliance, and I'm going to keep it that way. We don't want to be heavy-handed. This is not about getting people into trouble. It's not about throwing the book at anyone. We all need a reminder. We all sometimes need a gentle reminder. Hey, remember to wear your mask, remember to wash your hands, remember to keep 6 feet. So we're going to be there as necessary, asking you to space out if you get too close. We do need to do a better job at mask wearing when we're in public. Obviously, you don't have to wear your mask when you're on your blanket at the beach or going for a walk at the beach or playing ball at the beach. But if you go to the bathroom or you go to a pavilion or you go to pick up your food at a concession stand at Lincoln Woods, please put your mask on for that period of time. I will say, like with everything, it's just common sense. If you're going to be next to somebody for a minute or two, then it's okay if you don't have your mask on. If you're 6 feet apart on a continuous basis, you don't have to have your mask on. But if you're going to be next to someone for 10 or more minutes, closer than 6 feet, even if you're outside, we need you please to wear your mask. Now, I do want to make a special note about the Block Island Ferry. My office got a lot of complaints over the weekend that the Block Island Ferry was too crowded and very few people were wearing masks. So I want to address that for a second because we were, I don't want to say overrun, but we got a lot of phone calls and emails. First, I want to thank the operator of the Block Island Ferry. Everybody should know they were doing their best to enforce the rules. They were making regular announcements. They even put an additional ferry on because they wanted to alleviate crowding. They ran an extra ferry to get folks back from the island, so I want to thank you for doing that. For the patrons, I would ask you to try to do a better job. If you're going to be on the ferry, it's an hour ferry ride. It's not 2, 3, 4 minutes. You're there for an hour. So even if you're at the top deck and the wind is blowing, if you're seated next to somebody for 20, 30, 40 minutes, please keep your mask on. Yeah, I know it's awkward, but it'll save lives, and a pretty easy, simple thing to do. So if you're alone and you're apart for 6 feet, fine, but there was a lot of crowding outside on the Block Island Ferry for a long time. People were not wearing masks. We have to do better. That's all. I'm asking everybody, try a little harder, do a little better. Listen, here's the reality. We don't want an outbreak on Block Island. It is a very limited healthcare system out there. It gets incredibly crowded. We are working really hard to keep Block Island open. There's a lot of people who want to make a living out there. That means the rest of us have to play our part and please wear our masks. This weekend, over the weekend, we focused on inspections of restaurants. We had over 150 inspectors out throughout the weekend, just focused on restaurants, because we want to have a feel for what's going on in the restaurants. Excellent results. I just want to say, great job, Rhode Island. Great job to the restaurants. Not perfect, but by and large, we visited hundreds and hundreds of restaurants. There were no salad bars, no self-service food, not congregating at bars. Bars were closed. People were wearing masks. Wait staff was wearing masks. No salt and pepper shakers on the table. No communal food. No communal utensils. No communal menus. So I would say it seemed like nearly everyone, 90+% of the restaurants, were adhering to capacity restrictions. So I would say, thank you. The one place we do need to get better, and I'm talking specifically to restaurant owners and managers, we only saw about 80% of compliance with the restaurants having their COVID-19 control plans at the ready. If an inspector shows up at your restaurant and asks to see your COVID-19 plan, we expect you to have it. So if you don't have it ready now, consider this a friendly warning that we expect you to have it. It's not that hard to fill out. Call Commerce if you need a hand. 521-HELP. Go on reopeningri.com. We have guidelines, we have templates. Please, we need you to have your COVID-19 plan. And if we continue to show up and you don't have it, then in that case, there will be consequences. But overall, I would say it was a good, safe weekend in Rhode Island. And hopefully 2 weeks from now, what we did this weekend will show up in the data in 2 weeks. Let me say that again. What we did this weekend will show up in the data in 2 weeks. And I really hope in 2 weeks we don't see any spike so we can start thinking about phase 3. So let's all buckle down now and continue to follow the rules so that we can move on to phase 3. Okay, I want to talk for a second about testing. It's important. I talk about it a lot. Last week we rolled out a testing program for people who don't have symptoms, asymptomatic testing, and unfortunately it's going slower than we need it to be going. Over the weekend, we only had about 250 people sign up for testing. And over a weekend, we want to be more, 800, maybe 900. Weekends are slower, but 250 is not good enough. So I'm going to remind you what the rules are. If you are a personal service worker of any kind, hairdresser, nails, tattoo, massage, any kind of a salon, restaurant worker, childcare worker, bus driver, and you feel fine, you don't feel sick, we would like you please to consider to get tested. It's free, it's easy. I would say it like this: I need you to do your part. It might not help you, probably won't help you. You're probably negative. But you'd be pitching in to help the state be safer. Think of it as your duty to Rhode Island. Help us do the people's work of public health. We need information. We need to know how prevalent is the disease among hairdressers, how prevalent is the disease among waiters and waitresses. So please, I know I'm asking you to do something. You might not personally get anything out of it. It's the right thing to do. It keeps everyone healthier and safer. It's free, and it would be doing your part to keep Rhode Island safe. How do you get tested? You could go to portal.ri.gov, or you can call the Department of Health 222-8022 and sign up to get a free test. Over the weekend, there was a beautiful, impactful, peaceful protest in Providence, a couple thousand people. If you were there, please go get tested. We want everyone who goes to a protest to go ahead and get tested. It's free, it's easy. Same thing, portal.ri.gov or call the Department of Health. You don't need insurance. They're not going to ask you a lot of questions. They're not going to ask you about your immigration status. Just sign up for a test if you went to a protest and go ahead and get yourself checked out. As I said at the beginning, we are where we are. Rhode Island is literally leading the nation in our response and our results because the people of Rhode Island are pitching in, doing what's been asked for them, following the rules. So if one more time you could do that by getting tested, I'd appreciate it, and it'll really help us to keep everybody safe. I want to talk for a couple of minutes about summer camp, and summer school. So last week, I announced that our plan and our goal and our mission is to return to in-person school when school starts in the fall. And we have said that school will start August 31st. We say the fall, it's actually August 31st. I understand that for some of you, particularly the kids, that seems like a long way away. It's actually right around the corner, and we're going to be working hard all summer to be ready so that you can return to school safely. I want to take a few minutes to address some of the things that we're doing through the summer to help our students and to get ready for the fall. So, by and large, distance learning went very well. It's far from ideal. I'm not pretending it was as good as in-person school, because it's not. I think it obviously got harder to do effectively the longer it went on. But our children didn't miss a day of school, and it was a fine substitute and certainly the best alternative. Having said that, it's been hard on parents, been hard on everyone. It's been hard on teachers, been hard on the kids. But we've heard from many, many, many parents. They had a hard time teaching their kids. They had a hard time juggling their own jobs full-time at home with teaching their kids at home. And it has created a fair bit of, stress and anxiety for parents and kids in Rhode Island. And I know that. I hear that. I feel for you. I've got 2 kids of my own at home, and definitely we had our share of ups and downs. And it's especially hard for the littler ones. Kids in high school and middle school, it's a little bit easier to log on and do their thing. For the little kids, it required a lot of parental input. So, and some kids didn't get everything they needed, and we have to acknowledge the fact that we have to, be there for our children. So first, I want to thank you, parents. Parents were always heroes, but you really earned your stripes through distance learning, so thank you. Secondly, I want to let you know of a few things this summer that are available. So starting June 29th, we're going to operate in-person summer camp in Rhode Island. The guidelines for reopening are available now on reopeningri.com. And from what we're hearing, many programs are opening this summer. I'm mentioning this again because we continue to get asked by a lot of people, is there a summer camp? How do I find out about it? The answer is yes, it's happening. It's starting June 29th. There's even some sleep overnight options. And I would just encourage you to get in contact with either your city or town, if you usually send your kids to a municipal program, or whatever camp program you normally will do. We are hearing from a lot of the camp operators that it's more expensive. It's expensive. It's expensive to operate. You need more staff, more cleaning supplies, masks for the teachers, et cetera. So the good news is we received $7.5 million in CARES Act funding, and that is going to be used to provide financial support to summer camps. It's going to give you a hand in following our rules. If you have an interest in learning about this or applying for it, you should today visit reopeningri.com. There's an application process. Go ahead and apply. The application period is open, and applications are being approved on a rolling basis. So the sooner you get your application in, the quicker you'll get approved, the quicker you can get your funds, which can be held. You can use the money for extra staffing, cleaning crew, extra cleaning, whatever you need to meet the needs of providing this. I'm telling this to the camp operators, so you go to reopeningri.com. I'm telling it to the parents so you know it's not camp as usual. Your kids are going to be safe. We're doing things differently. And so I would encourage you to consider camp for your children if it's something you would typically do. In addition to that, and in addition to our existing summer educational programs, we're also adding additional continued virtual learning this summer. So some kids got behind with distance learning. There's no denying that. No denying that. Some kids got behind. We're not going to sugarcoat it. We're going to make a plan to help them and help them to make up over the summer what they may have fallen behind on during the school year. So I'm excited to announce right now that Rhode Island public school students will have the opportunity to sign up for what we're calling SAIL courses through the Department of Education. SAIL, S-A-I-L, is a temporary program designed to enhance educational opportunities for our students through the summer. The goal is to provide all public school students from pre-K through high school with fun educational opportunities through the summer. Now, I'm sure there are some students saying, oh, great, thanks, Gov, more summer school. Why would I want to do that? Hopefully there are some parents saying, great, because my kids need help. Here's what I would say to you. There's a lot of fun classes that we're making available, enrichment, arts classes, even physical education virtually. There's also things specifically designed to help you catch up in math, in reading, in English. So I would encourage you, parents and students, to go on the RIDE website as of today, the Department of Education website, and take advantage of it. It's free, it's available to anyone, it's excellent curriculum. RIDE's worked very hard, and it's a way to prevent summer learning loss, maybe catch up on something you fell behind on. We also know that a lot of high school students need to earn some money over the summer, and this summer we are creating a COVID response youth summer jobs program to support employers who hire Rhode Island youth for summer jobs related to the COVID response. And this is being run through the Governor's Workforce Board, and you can get information about that on reopeningri.com. So what does that mean? So if you're a high schooler who is looking for a summer job, you can go to reopeningri.com. There's a special initiative, Youth Summer Jobs Program. We have certain employers, like Honeywell, for example, who's, they are making PPE in Smithfield. They're looking to hire summer young people. We're going to help match you up with them and provide you with a stipend. So we're trying to do our best to help kids this summer study, have fun, go to camp, get a job, stay engaged. And everything I just said you can find out about at reopeningri.com or the RIDE website, the Rhode Island Department of Education. Okay, a quick note on graduation. I want to remind everybody that the special statewide graduation ceremony is tonight. It's tonight at 7 o'clock on Rhode Island PBS. And right after the graduation, we're going to have a virtual concert. Thank you to the United Theater. That's called United for Grads. That's also going to be on PBS. It's going to be great. You know, we worked hard on it. I hope you have a chance to check it out. We have some Patriots players, Viola Davis, Stephen Colbert, Seth MacFarlane, a bunch of other bands. It's going to be great. It's not in person, but it's from us to you, class of 2020. You deserve this and more, and we hope you have a good time with it, and congratulations from us. We're proud of you. Finally, this weekend is Father's Day. I know for many Rhode Islanders, that means going to see Dad, and that could be a great thing to do. However, if Dad is in a nursing home or is sick or has an underlying health condition, we would just ask you to exercise extreme caution. And Dr. Nicole Alexander Scott is going to talk about that, especially as it relates to nursing homes. But the reality, you cannot escape the brutal reality of this disease, which is that it is very cruel to people who are older, who are sick, and who are frail. So if your dad has diabetes or asthma, or he's in the hospital, or he's frail, or he's older, you might think twice before visiting him, particularly if you've been sick or you've been with a lot of other people. Also, social gathering limit is still 15, so if you're gonna have a family party, it's 15 and fewer. That said, we love all our dads and godfathers and uncles and grandfathers, so obviously let's make it special and honor them, but please, I'm begging you, keep it safe. So with that, I'm going to turn it over to Dr. Alexander Scott and come back for questions.
Thank you, Governor. Good afternoon, everyone. I will get started with the data for today and for the weekend. We have 32 new cases to announce. We had 73 new cases on Saturday and 46 new cases on Sunday. While we generally do see a slight dip over the weekend usually, it's definitely good news that these numbers are as low as they are while we're continuing to test as many people as we are testing. There are currently 127 people with COVID-19 in the hospital. Of these 127, 21 are in the intensive care unit and 14 are on a ventilator in the ICU. These hospitalization numbers have also been stable and low. Unfortunately, we have 6 new confirmed COVID-19 fatalities to announce for today. Our total increase in fatalities since our last data update on Friday is 18. 7 fatalities were confirmed on Saturday, and 5 were confirmed on Sunday. The majority of these people were in their 80s. 8 of these Rhode Islanders were in their 80s. 1 of them was in their 40s. 3 of these people were in their 50s. 1 of them was in their 60s. 2 of them were in their 70s. And 3 were in their 90s. Our prayers go out to the families of these Rhode Islanders who have passed and to all Rhode Islanders who have passed away. We know that it's not easy for families, and our hearts are with you. Shifting gears, as the governor just shared, Father's Day is next weekend, and we know how important it is to honor and celebrate the dads, grandpas, uncles, and other father figures in our lives. We absolutely want people to do that. And as the governor has shared, we want people to be able to do it safely. We know that people recognize that this Father's Day is going to be a little different than other Father's Days. And we want to support you in being able to still acknowledge and honor the father figures in your lives. Social gathering size is still 15, as you have heard, and it's important to make sure to bring your mask and to wear it where you can. If dad or grandma or grandpa, or other people in your family are either on the older side or have underlying conditions, also consider staying home and consider connecting over the phone or other ways to be able to engage with them and tell them how much you love them safely. As much as we all want to get together, being together in person can be risky for some people. This is why, as much as we don't want this to be the case, in-person visits in the same room are still not allowed at nursing homes and assisted living facilities through phase 2. If you want to connect with someone in a nursing home or assisted living facility, particularly for Father's Day, just because you love them and miss them, there are many different creative approaches that we are encouraging people to explore. For example, we have talked to facilities about safely and quickly doing drive-up visits. This has to entail you calling the nursing home or assisted living facility, making an appointment to be able to see your loved one, and then going at your appointment time to see your loved one while remaining in your car. That is critical. The nursing home or assisted living facility resident would be brought out, but would have to be distanced from the car more than 6 to 10 feet, and additional safety measures must be in place. Wearing masks, keeping windows up, being able to say hello from afar, but through a drive-up visit approach. I want to be clear that not all facilities are going to be able to do this. The layout of a facility's property or other obstacles may prevent this from happening in all instances, so we want to make sure that you continue to engage every other type of way to interact. Other ways that people can connect with their loved ones in nursing homes and assisted living facilities to really show your love by helping them make sure that they stay safe is by sending packages with photos or other handmade items that can really make a difference. Doing a virtual visit using FaceTime or one of the video apps that are available, or coordinating the delivery of a special meal or snack for your loved one. We want to support you to continue to demonstrate your love by keeping your loved one safe. That is critical. So to make one final additional point, we have heard from many people who are being told by their employer that after being COVID-19 positive via a test that was done, that they need to be retested before returning to work. Generally speaking, people do not need to be retested to return to work. There are other ways to ensure that COVID-19 is no longer in place and it is safe to return to work. Someone who has COVID-19 by identification through a test or just with symptoms and exposure and they're concerned should isolate, recover safely at home for at least 10 days after their symptoms started. So the day your symptoms started, at least 10 days have to occur where you are recovering safely at home. Once those 10 days have passed, and only if you have been fever-free for 3 full days without taking any fever-reducing medicine, and any respiratory symptoms you've had has improved, then it is okay to come out of isolation, and that means it is safe to go back to work. This recommendation is based on the latest science from the Centers for Disease Control and Prevention. It is an approach that we have been recommending, and I'm sharing now so that everyone can continue to be educated on the safe ways to return to work. Centers for Disease Control and Prevention researchers are finding that the evidence shows that after the 10-day period has occurred, it is unlikely that transmission of COVID-19 takes place any further. We're only recommending to get an actual test to confirm that you've completed COVID-19 to end isolation in very specific situations. For example, if someone is a healthcare provider in a long-term care facility and has the need or is immunocompromised in a particular situation, those are scenarios that we are supporting from the Rhode Island Department of Health standpoint, testing to occur. But for the majority of people, it is acceptable to say that symptoms have resolved once you go through that 10-day period of isolating to recover safely and have 3 days of no fever and your respiratory symptoms have fully resolved. We call that the time-based or symptom-free based approach, and that is something that should be used and is acceptable. So we want to make sure that employees and employers are aware of that approach. And with that, we'll get started with questions.
Doctor, I know you're asking folks who are protesters to get tested. Are you actually tracking that? And what are you seeing so far?
We are encouraging everyone to get tested. We are not specifically determining if someone or asking if someone is a protester, but we are acknowledging that if someone has participated in a large gathering, that is a way to go ahead and be tested. If they've gone to a protest where there is such a large gathering of people. As the governor mentioned, we've been seeing lower numbers, particularly over the weekend, than we would like. Towards the end of last week, we were well over 1,000 people who have been tested overall through the self-scheduling portal. So it's portal.ri.gov that we continue to encourage people to go to be tested if they fall into one of the work categories that the governor has shared, or if they have attended one of the protests.
Doctor, I know it's been 10 days since the large protest in Providence, and so that's on the early end of seeing cases, but do you have any indication so far that through your contact tracing that anybody who was at a major rally was sick?
It is still early, but we are not seeing any large numbers as of yet. I'm encouraged because the mask wearing, particularly with the thousands of masks that the Rhode Island Department of Health handed out, mask wearing during the protests that had occurred the week prior was very good. And so we're hopeful that that did its part. As we know, masks are very effective in stopping transmission. So we're going to continue to see if the numbers stay the way they are, and it will help affirm the necessity of wearing masks and staying home if you're sick.
Doctor, I noticed that not only the Providence protests, but in Newport, a number of people wearing black T-shirts with the Rhode Island Department of Health's emblem on them. Are they the folks that were out there handing out masks and so forth? And were they reporting back to you or the administration at large with any specific information they may have seen out there?
Yes, if they had the black T-shirt with the Rhode Island Department of Health, they were either our awesome staff or partners to the department who wanted to be present to help ensure that people are safe, giving out masks, giving out information on COVID-19. We very much appreciated those that offered to do that. I didn't collect any additional information beyond that. We have supported those who have done that to go ahead and get tested. So that was done during this last week, and anyone else who attended the protest is what we recommend as well. I've done that as well.
Governor, on the summer school, are you, the summer programming, are you giving any guidance yet about whether districts should be allowing students to keep their laptops or Chromebooks? I think about that as like a problem in Providence and some of the urban districts.
Dan, can you just talk louder or take? Go ahead.
Are you encouraging districts to let students keep their Chromebooks or whatever is provided by districts?
Yeah, it's a great question. That's their call. I know, Matt, that is the call of the district, but I would say yes. I mean, because we want kids to continue to do schoolwork over the summer, which is why we're putting out this whole new SAIL initiative. And we know that there are many kids who don't have their own laptop. So I'm not going to tell the districts what to do, but I think it's a good thing to do.
Dr. Alexander Scott, I was just looking at the new data, the demographics, and one of my colleagues actually spotted that there is now an entry in the age group of 10 to 19, a fatality. Is that just a reporting error, or did that actually occur?
No, unfortunately, there was one COVID-19 death that we confirmed late last week as a pediatric death. This person had a very significant underlying health condition, tragically. And there isn't any more information that we're able to release, but that was something that we were saddened by, but also were aware of.
Can you just sort of talk anecdotally? I mean, this is the first pediatric death that we've seen. Should parents be concerned? Was there any connection to the inflammatory illness that we've seen pop up in other states? I know you said this person had a severe underlying health condition. So what does it mean, essentially?
Yeah, it is more so connected to the unfortunate underlying health condition, less so connected to any other concerns that have been seen in other places regarding pediatric cases. So they unfortunately fell into the category that's similar to those who are either older or have underlying health conditions, and this one had some more severe ones, which unfortunately put them at significantly increased risk, and that was certainly an exception compared to what we're seeing, given that the numbers among pediatric cases is extremely low.
Did this child have any connection to group living? Were they in DCYFK or anything like that?
I don't have that additional information on them.
Governor, as you probably know, New York Times reported over the weekend that you have had conversations with Joe Biden's team about potentially being vetted for vice president. Can you talk about that, or have you actually had these conversations?
Yeah. One of your colleagues asked me about this a couple of weeks ago, and nothing's changed since I answered it then, which is to say, I am 150% focused on doing my job in Rhode Island and spending no time on politics. I have the job I want, which is being governor of Rhode Island.
But to be clear, the Times reported that you have had conversations with the teams. Were they wrong?
I have nothing more to add than what I said.
Governor, can you sort of, looking back on the last few months, there was a point where it seemed like, you had reported you were barely sleeping, that it was around the clock, a 24-hour operation, the whole team at large. What is that operation like today? Are you able to spend time on things outside of COVID a significant amount of time? What has changed in your world in recent times?
So look, it's a challenging time to govern. We have historically high unemployment. None of us has ever really lived this kind of unemployment. The record over 200,000 unemployment insurance claims. A public health crisis, global public health pandemic. And civil unrest. The race riots. It was just last Monday night, I think, that we had, or maybe 2 Mondays, it was recently, that we had looting and cars on fire in the capital city. So I'm not gonna lie, we have our hands full trying to lead Rhode Island securely through these three major crises all at once. On the one hand, we have a much firmer handle on the COVID response. I mean, now I have a full-time team on testing. They are rocking and rolling, doing their thing. Pretty soon, we're gonna have 20% of our population tested. That's fantastic. We have a team on contact tracing. The app is up. Please sign up for Crash COVID RI if you haven't. So we're not out of the woods, as I've said so many times. And each day I begin my day by looking at the data and kind of hold my breath, hoping that we don't see any increases. And I look at other states and I get nervous. So we are on it, every minute. Speed matters. But we're in a much, much better place. Our hospitals have plenty of space in them. By and large, people are doing what they're supposed to do. We only have a few dozen cases, so that's good. I'm spending more time now thinking about how do we get people back to work. The stories are heartbreaking. I don't know if my restaurant can reopen. I don't know if my business will reopen. We've invited people to come back to work and people are too afraid to come back to work. So I think it's still a pretty 24/7 operation. I'm encouraging the team, myself included, to take a few hours here or there to refresh. COVID we feel good about it, but there's these two other big issues. I mean, just yesterday, 2,000 people protesting in the State House. This is real, and so we just have to lead through it. But I will just say, it's an anxious time for all people in Rhode Island. That's true for people all over the country. And we are doing about as well as anyone, and I am one foot in front of the other. One foot in front of the other. We're in a good position, and I am totally committed to make sure our economy is stronger on the other end of this than when we went into it. So I'm spending more time thinking about that. What are the investments we need to make so that we're stronger and when we come out than when we went in?
Governor, you're the governor, not the mayor. But if we go down this hill, the Biltmore is boarded up, the hotel at Fleming's is boarded up, all over Providence, you see stores boarded up. Is Providence open for tourism?
Yeah. So I can't tell business people what to do when they put those boards up because they were afraid. But it is safe and it is open for business, the city. You know, I'd encourage them, if I should say, like, it's okay to take the boards down. It's okay to hold yourself out for business. We had a scary week, and I'm not going to discount that. But we handled it, right? We kept the lid on the violence. We had no major injuries. I'm not minimizing it, but we were on it. And so it's time to feel secure, and it's time to be open for business. And it's true, I'm not the mayor, and I don't own a business, and I know they're nervous. But like we went out for dinner last Thursday night in the city of Providence. I'd like to keep going out for dinner in the city of Providence. Go to the mall, go shopping, go to Fleming's. Like, I think it's time to feel secure. We can't live in fear. We have an amazing state police, National Guard, and City of Providence Police Department. Let's get out there.
Tonight, the special for the seniors, and there's music. Mm-hmm. Now, what song are you performing this evening?
Nice try, John.
Doctor, back on the contact tracing, are you able, as kind of the case numbers go down, are you able to see, again, where some of these cases are coming from? Do you have any indication that some people are getting sick in crowds, whether it's at a store or something like that? Or is it mostly they can pinpoint who they got it from or who they may have been in contact with?
Yeah, that's a great question. Once we have community transmission, it is challenging outside of specific congregate settings to be able to determine where someone was exposed. We do have extensive conversations collecting that information to understand what their work setting may have been, understand what events they may have attended, or who or where they've been, who they've been with, or where they've been. It does reinforce the importance of the core recommendations, because we are seeing when you are wearing your mask, when you are distancing effectively, when you are staying home, when you're sick, it significantly decreases the chances of you being exposed in the community without knowing. So the more we can continue to encourage people, as the governor was just saying, being able to get out into the community, going to the mall or to the restaurant or to the store, knowing that wearing your face covering, using hand sanitizer, not going out if you're sick, those are the core ways that's the key message that we're getting through the data. Those are the core ways to significantly decrease your risk of being exposed.
Doctor, does the data that you have give you any ability to quantify relative risks from different activities? In other words, how much riskier is it to dine out at a restaurant than to take a RIPTA bus or to attend a protest? Do you have any idea of that?
We are assessing that at more of a national level. Our numbers are so small, it's challenging to specifically calculate what a relative risk would be and what the correlation is. But nationally, compiling that information, we're continuing to see the same rules of thumb. The longer you are in a closed setting, closely positioned without a mask, the higher the risk of getting exposed to COVID-19. The more you are wearing a mask, distancing, around other people for shorter periods of time, and out in the fresh air, much lower risk. So this weekend, my husband, our infant son, we spent tons of time at the park, outside, with our masks, just enjoying. And there were a number of people there, but fully felt safe because we were, taking advantage of those types of risk profiles. And our focus is to help people understand those differences so that you can continue to get the courage and comfort level with going out, keeping those types of rules in place. That's what works to stop transmission of COVID-19.
Governor, you were talking about the importance of getting people back to work. And as you may know, or I'm sure you know, that the PP program for most businesses expire at the end of June, at which point many of the people they took off, that they had laid off, will then be faced with either being laid off again if there's no work. And I'm wondering if you're anticipating a spike in unemployment as a result of that, what you would suggest in terms of either extending that program or also looking at the program that provides $600 a week to employees that in some cases has been viewed as a deterrent for those people to return to work.
Yeah, so there's a lot to unpack there. I'll say a couple things. I would support continuation of PPP, the loan program. I also am really counting on the federal government to step up with another stimulus. And I'm also open to using some of our emergency COVID relief fund to help Rhode Island small businesses. I'm just holding off a little bit longer on that until I have some clarity as to whether we're going to get another stimulus, because right now we're facing this unprecedented budget deficit. So there's a period of uncertainty for the next few weeks. The honest truth is we need Congress to take some action, and the sooner they do it, the better we'll be. I know there's consideration of extending the $600. I know there's consideration of extending the PPP initiative. There's a lot of talk in Congress around additional small business support. You know, any version of that is desperately needed in Rhode Island, and I am urging our federal delegation to work as hard as possible for it, which of course they are. You know, it's in the hands of Mitch McConnell and the Trump administration. But I'll tell you this, the impact to Rhode Island will be utterly devastating if we don't get another round of stimulus. I can't see a way around it. So to answer the other question, how I spend my time, I spend a lot of time talking to members of Congress, other governors, Republican governors. We're all in the same boat. And so we are all pushing Congress to say, do the right thing. Because if you don't help states more and don't help small businesses more, in whatever form they take, this recession is going to be a lot longer and more painful than it needs to be. So it's, as I am told, it's all going to happen in the next 4 weeks or so.
Thank you, everyone.
Thank you.
Bye.